Greetings, my friends. This is going to be the most vital video that you probably watched the entire year. I've been wanting to come and lay it on the line like I am tonight, but social media has been mirroring the government, imagine that, and really censoring what people can say about the coronavirus. But now that the CDC, aka the Center for Disease Control in Atlanta, and the WHO, aka the World Health Organization, which monitors the entire globe, have come out and said they expect the coronavirus to turn into a pandemic very soon and to strike the entire world, including America, hit the world like a hammer, hit America like a hammer. I've got a video. I'm going to share recent news with you, and I'm going to share all kinds of very, very important information that I've gleaned from across the World Wide Web, aka the internet, to give you things that may help save your life if you follow the advice given in the video. Now, the CDC admits the coronavirus is in at least 26 states in America. And again, they expect it to hit us like a hammer. Researchers find, this is all new news I'm giving you now. It'll be as of today, as of yesterday, by the time you hear this video and watch it. Researchers find 61.5% of coronavirus patients with severe pneumonia won't survive. Very, very bad stuff, especially the old, the young, and those who already have medical conditions. Mark Lipich, a professor of epidemiology at Harvard, T.H. Chan School of Public Health, said, I think it's likely we'll see a global pandemic. If a pandemic happens, 40 to 70% of the people worldwide are likely to be infected this coming year. Recovered coronavirus patients who have traces of the COVID-19, which is what it's called, in their bodies could infect others, doctors warn. Even after being cured, the doctors say this is dangerous. What are we going to do with them? They've been cured, but they still have the virus to pass. We can't send them home. They might infect others. You can't put them in the hospital as resources are stretched. What are you going to do? Hysteria over coronavirus in Italy is reminiscent of the Black Death, shutting everything down across Italy. Big news there. New report claims 2/3 of global coronavirus cases have gone undetected. Again, this is from the World Health Organization. 2/3 may have gone undetected. That shows you how terrible and rampant this thing is running, my friends. It's big news, big time. Global stock markets once again continue to crash on coronavirus fears, and global economies are starting to feel the effects. The Dow in America has crashed almost 2,000 points in the last 2 days. Unheard of numbers of falling. This is big stuff. Globalists look to exploit coronavirus and push for global government. Read about this today. I'm not surprised at all. I wouldn't doubt that at all. I would never discount that all the big countries in China, where it started, one of the biggest spy countries in the world, could be using this to start implementing the New World Order. Big stuff, my friends. The CDC states that the virus spreads by respiratory droplets produced when a person coughs or sneezes. Transmission is similar to other coronaviruses such as SARS and MERS, and the CDC believes that the COVID-19 spreads as easily as the common flu virus. Some important questions, such as whether or not a person can infect others when they show no symptoms, called asymptomatic, remain unanswered. However, a 2020 study published in the New England Journal of Medicine states asymptomatic transmission can occur. And here are coronavirus symptoms. Very important to remember this. It presents a serious global public health threat and can be fatal. Many times it is. The CDC believes symptoms of COVID can manifest between 2 and 14 days after initial exposure, based both on early data and incubation period for SARS and MERS. Symptoms include fever, shortness of breath, cough. So far, people who are at the most risk of developing these conditions again are elderly, the young, and those with pre-existing medical conditions like diabetes, heart disease, etc. The best way to get trustworthy, up-to-date information on the current outbreak is through the WHO's situation reports, which they publish daily. The WHO also has a Mythbusters page where it uses scientific information to debunk ongoing myths and hoaxes about the virus. How to prepare for a pandemic. Very important stuff, my friends. According to Harvard Business Review, current models suggest that a pandemic might sweep the globe in 3 distinct waves, each lasting from a few weeks to 3 months. This means that you and your family should be able to survive on your own, at home, for a significant amount of time if you have to. Preparing for a pandemic is an important part of disaster planning and requires many of the same steps. However, there are some additional precautions you need to take in order to keep your family safe. Be prepared to treat at home. This is number one. Healthcare workers will face an ethical and moral dilemma during a pandemic. Do they report to work and help care for the sick, putting themselves and their families at risk for infection, or do they stay home and help ensure their loved ones don't fall ill? According to a survey conducted by the CID-RAP, almost half of healthcare workers admit they would stay home during a pandemic. I believe it's much more than that. Another study published in the journal BMC Public Health found 28% of healthcare professionals agree it would be acceptable to abandon their workplace during a pandemic in order to protect themselves and their families. Even if only 10% of healthcare professionals opted to stay at home during a pandemic, another 10% fall ill themselves, that's still a conservative 20% reduction in the medical labor force at a time when hospitals and doctors' offices will be flooded with patients. There's a chance some patients won't be able to get in to see a doctor at all. I bet that most won't. Medication could also be hard to obtain. According to a 2006 study conducted by the Harvard School of Public Health, 43% of people believed they would have difficulty obtaining medicine should they have to stay at home during an epidemic. During the 2017-2018 flu season, which turned out to be slightly more severe than normal, the LA Times reported pharmacies in California had medicine shortages. Supply disruption is also a real possibility during a pandemic. In order to save on storage space and costs, most hospitals and pharmacies only keep enough medicine on hand for a few days, depending on daily deliveries to keep their supplies stocked. In addition, many life-saving medicines are now made in Asia. If a pandemic occurs, there's a good chance that deliveries will be interrupted or halted entirely. Stores are also likely to sell out over-the-counter medication very, very quickly. Stocking up now means you'll already have what you need should a pandemic occur, and you'll be less likely to leave the house for supplies, potentially exposing yourself to the virus. Consider stocking up on the over-the-counter medications like pain relievers, cough and cold medicine, stomach medicine, including anti-diarrheal and vitamins. Remember, this is a viral medicine, a viral infection, so antibiotics won't help. Number two, plan for a sick room. The CDC recommends during a pandemic, the sick should stay in a dedicated sick room in your home and use a dedicated bathroom that no one else will use. Start thinking now about which room in your home would work best as a sick room. If the room doesn't have a door, have an extra plastic shower curtain on hand to partition it off from the rest of the house. If someone does fall ill, quarantine them to the sick room and clean the room daily with bleach. Number three, stock up on food, water, and household supplies. The Department of Homeland Security recommends that families have at least a 2-week supply of water and food to prepare for a pandemic. I recommend probably a 2 or 3 month supply. Supplies for a month or more are even better. Typically, you'll need 1 gallon of water per person per day for drinking and hygiene, because you can't count on the water being up because people could be sick and not be able to supply the water at the water company. Building a long-term food storage pantry means you won't have to put yourself at risk of infection by going to the store, and you'll be insulated from the food shortages that could very well occur during the panic of a pandemic. So what should you stock up on? Focus on shelf-stable foods that your family already eats and enjoys, like beans, protein bars, soups, peanut butter and jelly, coffee and tea, powdered drink mixes, nuts and dried fruit, beef jerky, pasta, instant soup, flour, baking essentials, baking soda, salt, yeast, sugar, pickled vegetables, dried milk, evaporated or condensed milk, trail mix, applesauce, comfort food like cookies, candy bars, and chocolate, oils like olive and coconut oil, crackers, oats, pancake mix, cereal, chicken and beef and vegetable bouillon cubes, liquid seasonings, liquid sweeteners, spices, packaged foods, canned meats, formula or baby food. You should also stock up on supplies you'll need to stay healthy at home. These include hand soap and sanitizer, bleach or other cleaners, toilet paper, Kleenex, prescription medication, fluids and electrolytes like Gatorade and Pedialyte, garbage bags for medical waste disposal, plastic gloves. Although the chance of an outage is remote, it's possible again that utilities and power supply companies may be interrupted or stop entirely if a large portion of the work population falls ill or has to stay at home to care for sick family members. Have enough supplies to survive without power for several days or weeks, including flashlights, lanterns, a hand crank, or solar-powered radio, and the ability to cook food without electricity, such as with a solar oven cooker. I also have a generator. I've had it for many years. I recommend getting a gas generator. You'll be able to get gas somewhere, and you'll be able to cook food, run the important things in your house. It'll make a huge difference for you. It's been a godsend for me over the last decade and a half. Make an emergency plan. Number 4. If a pandemic is suspected, the CDC reports it's likely schools will close early to prevent the spread of the disease, and they could be closed for weeks or even months. How would you care for your children if you were still expected to report for work? Under what circumstances would you stop attending work in order to protect yourself and your family from illness? Do you have enough in savings to stop working for a period of time if necessary? Number 4, explore natural and herbal medicines. While it's important to have over-the-counter medications on hand to treat symptoms, it's just as important to have an herbal medicine kit in your home to complement commercial medicine. Some herbal remedies are great frugal flu treatment and can even be better and much more effective than store-bought medicine. This is from me. And I'm going to try to put all this as much as I can in the box below the video as much as will fit. I have a character limit, but I'll try to put all this important info down there for you to be able to have at your fingertips and copy and paste and keep a list at home. My wife and I never get the flu shot, and we never get the flu. I believe the reason why, other than God's protection, is because of the super duper powerful natural antiviral machine recipe that I created myself and have taken years, and we've been taking for years. This is how you do it. Get a gallon container. Put in 2 quarts of water, 2 cups of pineapple juice, cup of lemon juice, 2 cups of apple cider vinegar with the mother. It'll say includes the mother on the front label because many don't know what the mother is. A half cup of minced garlic, 2 tablespoons of cayenne pepper, 2 tablespoons of turmeric root, 2 tablespoons of ginger root, 2 tablespoons of Ceylon cinnamon, and add water if needed to fill the gallon container. You can get all this stuff really cheap, 2-day delivery if you have Amazon Prime. Put powders in first, then add liquids. Shake thoroughly so no honey or powder is stuck to the bottom of the container. Take 1 to 2 ounces 3 to 4 times per day or more if you want with meals and or snacks. It's a huge, huge boost for your immune system. Number 5, practice prevention now. Several simple actions can dramatically reduce your risk of catching and spreading an infectious disease. The CDC recommends that you wash your hands for at least 20 seconds with hot soapy water whenever you come back from any public place or have been around anyone who's sick. And I've stopped going to the gym now. And I recommend people don't go to any big public places where they can get sick. I've told my wife, I'm a pastor of an online church, so my church is 7 days a week. I've told my wife she should stop going to her brick and mortar church until this calms down. I recommend that to others. You have to make up your own choice. You can watch church online at my YouTube channel or elsewhere, but you don't want to be around any large groups of people because this is going to spread like wildfire anywhere. And I'm going to start shopping at the stores I already have late at night, right before stores close, or in the middle of the night for 24-hour stores like Walmart or Meijer, etc. So I can be around when there's less and less people around. Also, keep your hands away from your face, particularly your eyes, nose, and mouth. Cover your cough and sneezes with a tissue. Stay home when you're sick and don't go out until you've been fever-free for at least 24 hours without the use of fever-reducing medications. Clean frequently touched surfaces and objects. Start practicing these actions with your family today, especially if you have young children. If you get these habits now, they'll be second nature to you when the pandemic occurs, reducing the risk that someone in your family will get sick. Also, you can put a respirator mask on when you go out and about. Do all the smart things, my friends. It's very, very important. Final word. It can be frightening to think about experiencing a severe pandemic. Plenty of movies like Contagion and Outbreak play on the fears and show us in terrifying detail what it might be like if a pandemic ever became a reality. Preparing in advance is one way to alleviate some of these fears. It can be frightening to think about experiencing these things again. If you have the ability to take care of your family at home for a significant period of time, you won't have to worry about going to the store and exposing yourself to the virus. You also won't have to worry as much about packed waiting rooms at the doctor's office or hospital. The more you prepare, the more in control you should be. You would be should the worst occur. And remember, hospitals are going to be swamped, my friends. Ambulances probably won't run very much for anything. There won't be hospital beds. They've said people that have heart attacks and have broken bones may have to take care of those at home. It's important to brush up on emergency medicine you can learn online to be able to take care of yourself if things get really, really bad. Because a severe pandemic will shut everything down, my friends. Schools, work, everything. School can be shut down for months. Work can be shut down for months. It can just be like a ghost town like China is in North and South Korea and like Italy's becoming. It can be a nightmare. This is very, very urgent to get ready for this, my friends, because a pandemic, especially one like this, is big, big news. It's bad stuff. This is a Christian channel, so I invite everyone who does not know Jesus Christ as Lord and Savior, pray the prayer, do the 6 steps I have right in the box below the video, and I'll have the rest of this stuff right below that prayer, because no one's guaranteed the next day, hour, minute, or second of your life. I just love you all so much, and I just pray protection for your family and God's blessing, and I just pray people get ready and prepare at all times for this. This is big stuff. Share with everybody you possibly can. It's urgent. Love you guys. Bye.